it's not just about that large-scale dimension it's gone. We want to look at some basic things that people need to do, people need to know in terms of warding off coronavirus. And not only coronavirus, there are other things, other diseases that will come. What do we need to do, to actually checkmate them? And that's why this morning we've gone to bring studio, Director of Public Health in Ogun State, Dr. Festus Olukayode Soyinka, is our guest this morning on Newdawn. Dr. Soyinka, good morning.
Good morning, sir.
Yeah, I know that it's been really a lot of work for you people in the last few days. I saw you on Sunday morning. When we were supposed to be in church, you were driving somewhere, all because of these. But before we go into the kernel of our discussion this morning, we want you to give us the story so far. This Italia, this morning, one of the papers reported that 100 Nigerians, had a contact with him. That's really scary.
Thank you very much. I think the important thing is that when people don't have information, sometimes they carry the wrong thing. We have a correct picture of what has happened. We should not forget that this person that we're talking about was brought by the company's vehicle from his hotel in Lagos. We shouldn't forget that. So he had no contact with people outside, members of staff of that organization. That is one thing we need to recognize. The other people that people may be concerned about in terms of contact tracing is the aircraft that brought him. But at that point also, he had no symptom. So we're not too worried about that. Because much more importantly, we need to also be told that the person in question was not even coughing. But it's just that the doctor who saw him was able to look at the presentation and the travel history to quickly have a high index of suspicion. So that has saved a lot of things. So the people that got in touch with this person are not more than, as at the count yesterday, 39. And they are people that work in that organization. And they are all of them, under monitoring. And none of them, this is day 5 now, none of them has developed any symptom.
Now we heard that he also lodged in a hotel here in the state.
No. He did not lodge in any hotel. The organization has their own guest home. That's where he lodged.
Okay. Okay, so that's settled because we're getting it from you.
Yeah.
From Lagos to...
The Lagos team is handling whatever happened in the hotel. He slept over before they went to pick him the following morning. And please note, as at that time, this man had no symptom.
Okay, now let's look at the efforts of the state government in the last few days. I know it's been almost working around the clock for you. The people of the state would like to hear from you as the man in charge of public health in the state.
Well, thank you very much. I want to say that good enough, there have been some level of preparedness before this issue came up. And the moment we had the alert, it has only strengthened our preparedness and our response. And we have initiated our EOC, which can help us to every day meet, look at situations, analyze situations, and respond. Now, we have a lot of support of His Excellency, who immediately that day also had a press conference, and the Honorable Commissioner, who also had a press conference on that day, and at least to help us to know that there's no cause for alarm. We're on top of the situation, and we're monitoring. Now we have set a lot of information to our disease notification officers at local government level all our health educators, they're busy providing health information to the community. And also at the state level, our DSNO, our epidemiologists, and our doctors in our various hospitals, including the private, we're sending a lot of sharing a lot of information with them. Because coronavirus is a new disease, so as much as we have, even with support from the Nigeria Center for Disease Control and WHO, who are also on ground to support us, we're sharing with people. We have also developed a Twitter handle, a Twitter page that we will start rolling out, and so that people can have information. Now, the presence of the federal government in Ogun, Lagos, and the presence of the Nigeria Center for Disease Control in Ogun, Lagos, is just because of we are important port of entry, so that they believe anything will break out, it will. So we're strengthening the system the more, now that we now know that we have one case, so as to ensure that we do all that is needed. For instance, this case when we swung into action, the same day, moved to that organization, got the contact line listed, and immediately isolated them in their own facility. So this is beautifully handled, because there's no need to move them anywhere, and they're doing very well, very well.
Okay, now let's look at possibilities.
Okay.
Possibilities and how we need to deal with those possibilities. I mean, there are a whole lot of ways that people can actually come in contact with these: the schools, banks, public places, churches, mosques, and all of that. What do people need to do?
Okay. Now, the first thing I will tell us is that, number one, there's no need for panic. We should get the necessary information and develop practices that will keep us safe. One, if you are sick with cough, fever, sneeze, yes, these are things that can happen from other diseases, other just little infection and not coronavirus. But one of the precautions we're taking is that if you are sick with any of those symptoms, self-isolate until the symptoms disappear. Or if we're thinking of such disease, then probably for 14 days. That's a very good one. Now, don't mingle with crowd. It's just a precaution for this period. Now, then when you want to sneeze or cough, don't cough into your hands. Use tissue or use handkerchief and dispose immediately and appropriately. Okay? Now then, regular hand washing should become a practice that we have adopted. Everybody, not just because of coronavirus, the issue of cough hygiene and the issue of hand hygiene should become part of our life, because it will save us from a lot of airborne diseases and diseases that can be gotten by touching surfaces and the like. So if we take that as a regular practice, then we will be safe. Now, people talk about schools. Now, the same thing applies. Just like in workplace, anybody who is sick, give him excuse not to come to work for that period, especially with those symptoms we mentioned, just for this season. Because these are common symptoms we have from common cold. People have TB also, which is going to give you cough, fever, and whatever. The only thing is that the fever with TB is not high fever, like we know for coronavirus. So these are things. Then the symptoms of coronavirus are also still emerging as it is spreading some other thing. You know, the way people respond to diseases vary from person to person's, race to race, and the like. But generally, if you are sick with sneeze, with cough, fever, self-isolate, don't mix up with crowd and whatever. But this is not to say that we should keep away from people. But for health workers who are attending to such persons, when they're taking their temperature, we say keep a distance of 5 feet. That's about 1.5 meters. So that is safe enough. Because the organism we're talking about can be spread through sneeze, through cough, droplets of water that follow such action, splashing into the air on someone else can be inhaled, and that's how it spreads.
Now, hand washing in the schools, isn't it high time that we incorporated these into our system in Ogun State? Because I remember very well during Ebola, the outbreak of Ebola, it was fashionable in most places. Now, after that, it's gone.
Well, I can't say it's totally gone, because it's not only Ebola, even cholera and Lassa and whatever. We've kept on teaching hand washing. It's something we repeat, we emphasize over and over. And I remember that when I was in primary school, there's this song that we normally sang, which is one other way. If we can reintroduce those kind of songs, then it will help us children in school to pick up such practice. They say, there's element of hygiene, there's element of nutrition. So the hygiene part of it, maybe if our schools will package it in form of songs that we can also get across, so that not just in school, it must become a practice. Because you see, we touch surfaces. This is not because of corona, but for disease condition generally. We touch surfaces here and there. We don't know what was there. So we must develop, those practices. There is something recorded in the Bible about the Pharisees, that whenever they went to the market and they came back, they take a bath. Okay? That was a healthy practice. You come into your home, take a bath, wash your hand. If we're going to deal with hand washing properly as one major strategy, it will save us from a lot of disease conditions. A lot. Not just coronavirus, but we must seize the opportunity of this time to learn that practice and let it become part and parcel of us.
Yes, earlier on while you were talking, you mentioned, you talked about the need to give people break whenever they fall. They are sick. They fall sick. Yeah. Probably cough, sneeze, and the rest of the. Yeah. Now, have you really communicated to the Ministry of Education so that they can reach these schools, so that any students that display any of these symptoms, they can easily and quickly ask that child to stay away from school, or probably certain actions should be taken?
Thank you very much. Let me just say that, yes, we have gotten across to our school health workers. We have school health workers in some of our schools. We have gotten across to Ministry of Education. We're sharing postals with them. We have gotten across to our health educators at local government level. And we know schools and religious leaders are two key set of people that we need to get across to because of congregation and whatever. However, all these are preparations. They are preventive measures. The current whatever we have now does not warrant any panic or any fear. But there are preparation, things we must take to in case, God forbid, there is something like what we're having in some other countries, we will be able to, do the needful. There are preparations. It's not something to. I had somebody sending a message to me this morning and asking that what should we do with ATM machine, since it has to do with surfaces and people are touching and whatever. It's just what you need to do with your regular hand washing. Because the person was suggesting, should we now be going to ATM machine with gloves? It hasn't come to that, and it's not necessary. Even with your gloved hand, you can have false security. So the appropriate thing is hand washing with soap and water, or if you're in a place where you can't have access to soap and water, use the alcohol-based sanitizer. That's the information that is being shared. day in, day out.
We also hear that touching of body parts unnecessarily, that also should be avoided.
Well, touching of your face, because somebody is thinking if in the course of the day you have been touching surfaces and whatever, you have carried a lot of germs with your hand, not just coronavirus. You understand? For instance, you touch money. You touch money, you go to market, you go to work, you touch surfaces. And so we even advise that if you have a cut on your face normally, or you shouldn't peel, because you can introduce bacteria, not even this virus we're talking about. And when it gets into the bloodstream, you can get your face swollen, you know, a major infection that we call cavernous sinus thrombosis. So we need to realize that there are some healthy practices that this condition is helping us to throw up so that we can adopt them and stay healthy.
Now, you also mentioned it, because of the sensitivity of Ogun State and the positioning of Ogun State, some people are very scared of Ogun State constantly facing the challenge of this particular disease, coronavirus. If you look at the papers this morning, so many states of the Federation, Plateau State, there are issues in Plateau, Edo, and all of that. And these are states that, because of the position of the I repeat, the closeness. So Edo is close to Ogun State, whether we like it or not. It's really become worrisome for some people, because we had some calls from some of our viewers this morning asking government to actually get on top of this situation. But because you are in Ogun State, you work in Ogun State, your business is Ogun State, what assurance, rigid assurance are you giving to the people that
now,
nothing
let me just say that
will come near us?
Level of preparedness is very important. Awareness creation is very important, even during preparedness. If not for the awareness that is already created, both at the state level, national level, and everywhere, it wouldn't have been possible for that doctor to immediately have a high index of suspicion and pick that. And that's one thing we need. That's one thing we need. Now, you said Ogun is close to Edo and whatever. Ogun is close to Ondo. When there was outbreak of Lassa fever, and there were a lot of cases in other states, Ogun State did not have, so we had only one, which was. So, and there are several other states too that were not affected. So it's a matter of level of awareness, matter of preparedness, matter of people, health education that people have outside there to do the needful. So these are things that we need to know. Now, for us, we have initiated our EOC, Emergency Operations Center, by which we meet on daily basis to get information and strategize to prepare, for any eventualities. And in this, it's a multi-sectoral team in which we're joined by Nigerian Center for Disease Control, we're joined by WHO, we're joined by Port Health, even at the Diroko border, and people also around, and all the like. So we get our feelers from everywhere, in case any of those bodies also have any information to share with us at that point. And we have linkages with all our hospitals, the private through the Department of Hospital Services, the secondary healthcare facility through the Hospitals Management Board, then the local government level through the Medical Officer of Health. All these people are involved. Then our DSNOs are represented through the state DSNO. All these categories of persons are involved in this meeting on daily basis. So that, for me, gives me a lot of confidence that definitely with that network, we're sure that we can handle the situation.
In terms of public health, will you say Ogun State ranks among the best in Nigeria? Public health.
Public health, are you talking of general health?
General health. Because we're moving away from, we're trying to move away from narrowing ourselves down to coronavirus.
Now, when you look at the issue of health itself, there are a lot of factors that come into place. One, level of education of people also affect their level of health awareness. and affect their practices, for them to stay healthy. And you and I know that our people are, to a large extent, enlightened. With the support of media, stations like you, a lot of health programs come on board every now and then. So that's a lot of contribution. Then the issue of poverty level, which also can affect health status in terms of immunity and whatever. Well, we know where we rank, and not too bad. It's the general whatever in the country. But, our closeness to the commercial nerve center of the country does not also make things too bad for us in terms of people who are engaged, having meaningful work, taking to farming and all the like, and the efforts of the government in all sort of programs to engage our youth and all the like. So those factors are there. And Ogun State is blessed with at least a general hospital in every local government, at least. Then we have our primary healthcare facilities and whatever, all over the place. So I think we're not doing too bad.
Let's look at the health insurance scheme. I'm really taking you, globally now. It's I meet a whole lot of people, and what sometimes in engaging them, it's really surprising that people don't go to hospitals, especially because they can't afford hospital bills. And I know with the insurance scheme that the former administration came up with, which is Araya, the whole idea was actually to cheapen healthcare access to healthcare delivery and all of that. But it appears, I don't know, maybe we are ignorant. That's not really working. Is it dead and forgotten?
It's not dead. What used to be Araya before has also been absorbed into a bigger thing. We now have an agency, the Health Insurance Agency, which also is, with the support of the governor and the federal government, which is now a push nationally. Health insurance scheme will go beyond what it used to be before. Okay. So there's an agency in the state carved out from the Ministry of Health as an agency now that can handle that. But they are on the way to bring out.
Okay, great.
Now, when we were talking earlier on, you talked about the fact that once one begins to experience one or two symptoms that is associated with corona, that one should stay away from, one should isolate oneself. Now, you did not tell us at what point should one present oneself to
the hospital. Fine. Now, well, you see, like I said, one thing we must be careful about is the fact that we said let the person take excuse from work. Okay. Now we also say see your doctor. For instance, somebody coming with fever. We must know that the commonest cause of fever in this part of the world is still malaria. So when such a person goes to hospital, for everybody that goes to hospital now, we have we call it the temperature gun, a special thermometer that will be used to take your temperature. If it is high, will separate you this way and further explore into that fever. So at that level, if your history is taken, you have no history of travel, to any of those places that we know, any of those countries that we know that are actually fighting coronavirus now, then we will first of all test you for malaria, okay? And if it is not malaria, it is an infection, but we want to see anybody whose temperature is not resolving in 48 hours to suspect other things, not just corona now. Now, let me just say that one thing we need to tell our people also is in this kind of a time, as much as possible, self-medication may not help us. Many of us are used to, I have fever, I go to buy anti-malaria, I go to buy paracetamol and use, and the fever goes down. So we need to also, if we say that if it's not going away, after the system persists, after the third day, see your doctor. So that still applies. it still applies.
Okay. If you're just joining us on this program, we are looking at Ogun State government's efforts at warding off coronavirus. And according to the state's Director of Public Health, Dr. Festus Shoyinka, the state government has done a lot, and there's no need for anybody to fret, no need for anybody to panic. All measures have been put in place, and what we're doing here this morning is just to enlighten the public and let you know what you need to do basically to prevent this disease, not just coronavirus, any other disease for that matter. And so we open the line for you to also talk to us. Maybe you want to seek clarification, you want to ask Dr. Shoyinka questions about personal hygiene and all of that. The line is open for you. We'll take your calls, and Dr. Shoyinka will be here to give answers to you. Dr. Shoyinka, let's before the calls start coming in, national scale. Somebody said Nigeria in 10 days. China built how many?
I think 1,000.
1,000 bedded hospital for coronavirus. But the reports on the pages of newspapers, especially coming from NNA, is that the country is not ready.
Protective
yes.
suits and the rest of them.
Yeah, that a lot needs to be done. Beyond Ogun State now, what are your comments on this?
When people talk about not being ready, it depends on from what angle they are talking about. Let me tell you, we still need to educate our people a lot, even among the healthcare workers. Because people watch television and see China where people are wearing full PPE, we're looking at people that are dealing with patients, It does not mean that everybody who works in the hospital will wear full PPE. The full PPE we have ready. There's no problem about that. We did not acquire them because of Corona. We have full PPE in country. We have stocked a sizable number of them, even in the state. Because it's the same thing you use when you have Lassa. So, but for coronavirus, for doctors and health workers who are going to be attending to suspected cases, and yes, we have nose mask for them that they can use, the ordinary nose mask, and what we call the respirators. So this is not, it is only when you now have cases like the one that we had that we took to Lagos, then you have to do full length of infection prevention and control, in which case people who are going to be attending to such a person will now wear full PPE, just in case there are some other surfaces that you are touching here and there, because that protects them. Okay.
Anyway, so it means that people only react to what they see on television.
Yeah, because you see people, and they now think everybody should go around.
And there's no point wearing them if you don't need
those things are not comfortable. They are not comfortable to wear.
I was also saying there's no point wearing them if there's no need to wear them.
I still need bold to say that our air is still clean.
Okay.
Our air is still clean to breathe. So with regards to coronavirus, we had one person coming in, not even coughing, but were very much, high index of suspicion. We pick the case, and I think we should thank God for such swift of action. That's the truth.
How is the man faring now?
He's doing pretty well.
Doing well, okay.
Incidentally, we will talk about the issue of the fact that even coronavirus infection, when people present with varying grade of level of sickness, the man is mild infection in this case, and he will soon be discharged. That we know. He will soon be discharged. We got that information from Lagos.
Will anybody want to touch him again if he's discharged?
Well, once we say he is clean. Because if he's not clean, we will not say so. Because we are all in it, you understand? So that once we say, because we carry out tests from time to time to ensure that, not. So that's why I say he will soon be discharged. Just like we gave update on the Lassa fever case that we managed, that both mother and baby are fine, since been discharged. So once people are no longer sick and they no longer constitute danger to the public, why not release them?
Actually, yeah. Okay.
Facilities that we test for the virus, do we have them in circulation in the country? Do we have them?
No, you can't have per state. That's not something that is easy to come by. What it takes to put them up and the level of utilization you put. So it's kind of 4 facilities in country to test. We are very lucky that one of them is very close to us here, and which is Lagos. So there's no problem. We have one in Lagos, we have one in Abuja, we have one in Eluwa, in those states. I think maybe it's 3 or 4. Yeah.
Okay. The late MK Abiola said on a final note, because we are running on this interview, we're not really getting calls. Maybe our viewers are satisfied with your explanation so far. He said sometime in his life that why do we have to import technology, health technology into Nigeria when they are not particularly good for us? It was actually, he used an analogy. He said, if you bring in a doctor from a foreign country who has never seen malaria in his life, or malaria in his life, and you bring him here to design technology for us, that you're just wasting your time. So it's got me thinking that we really have doctors here, Nigerian doctors, who are capable of handling our situation, aren't we?
We do. If you are talking of those on ground or those of Nigerian nationality, we do. Now, when you talk about technology, the world has become a global village. You cannot but also look at advancement in technology and deploy them to what you are doing appropriately. In short, we talk about appropriate technology in primary health care, in public health. That's a technology that the community and the government can afford, and that is available, easily accessible, and socially acceptable to the people at every level of their development. So that's appropriate technology. So we will adopt technology appropriately. We cannot ignore advancement in medical practice. We cannot, ignore advancement in science. That's one good thing about the medical profession. It's science-based. If anybody say he has something, they will say, let's bring it to test. If you have brought it to test and you have documented it, others will test it. So it's not just your claim. So that's evidence-based action. So if there are enough evidences that something is working somewhere, why not adopt it if you can afford it, if it is also socially acceptable to your people?
Dr. Soyinka, we must thank you so much for your time, because we know that you have to be, you have to stand up and start running now. Difficult. All right, because coronavirus has not completely abated, especially from stories that we get on a daily basis. Here in the States, it's the same situation. The big men in the health sector, just like Dr. Soyinka, have been working around the clock, and so he has to leave again. He said, and I'm sure when need arises for him to come back here, he will come back, and or any of his colleagues to come to talk to us on what the state government has done as far as this particular one is concerned, coronavirus. We pray that it doesn't spread to the state anymore. Thank you so much for coming, Dr. Festus Soyinka, Director of Public Health, Ogun State, for coming. And probably we ought to, let's also drop the hotline. You brought some hotlines.
Yeah,
we'll be scrolling it here anyway.
Yeah,
so I would like to give it back to our viewers once more. If you just, if you have not seen it, let's let you know that you could call any of these lines, 081-8897-8392. 081-8897-8392. 081-8897-8393. That's the second one. 081-8897-8392. 978393. Why do they have to call these lines?
Well, because of our people at the facility level, if you are suspecting somebody has symptoms suggestive of coronavirus, you need to call these are the numbers at the state level. Then we will be able to get in touch with our disease surveillance and notification officer so they can respond to those things.
Okay.
And if there are some other questions or whatever, yeah, that can also apply.
All right, thank you so much. Just check our scroll bar. You see these two hotlines. Call them if you have any suspected case. Thank you so much for watching. We'll take this break now. I'll be right back shortly.
With the deadly coronavirus spreading fast all over the world, one must take preventive measures against contacting the virus. Some of these measures are: wash your hands with soap and water for at least 20 seconds or use alcohol-based hand